So the single most common question that I get from parents at the start of the intake process is, you know, does it make sense to pull my child out of school, out of these extracurriculars, out of these activities? I'll often hear things like, that's the only thing keeping them going is their participation in football, basketball, dance, cross country, or school, in some cases. I think it's a very valid question and concern that the parents have. I'll say a little bit about why I think it's less of a concern, and then also about kind of thinking about long-term outcomes and value propositions. So those are going to be two different parts of kind of dismantling this really important concern that, again, is the most common one I hear. First, from an educational standpoint, any teenager working in a partial hospital program, higher level of care, is going to have access to a school liaison, going to have access to a teacher, and they're still going to be keeping up with school. Schools will reduce the amount of coursework they have to do. Instead of 20 math problems on the assignment, they may have 5. Instead of writing a 5-page paper, they may write a 1 or 2-page paper, but they're still graded out of the same number of points. Right? And so kids' grades are unaffected, from the work that they're doing, even when it's reduced. And when it comes out on their final transcript, their grade is their grade that they have earned fair and square. It doesn't have an asterisk. It doesn't say, oh, was in PHP for 4 weeks. It doesn't alert colleges that any of this treatment was going on, as it absolutely shouldn't. And so, the overwhelming majority of our patients who are having issues in school are actually doing better in school on the semester that they're taking the time off for PHP, if not at the very least the same. It is extraordinarily rare for PHP to actually worsen a teenager's academic performance, even though I know that's at the top of the list for many parents. Regarding the extracurriculars, there are times when some of the extracurriculars still might make sense and still might be possible. You might have a teenager who's really struggling with depression and a substance use disorder. They're newly sober, and their big thing is playing sports after school. If they're doing PHP all day, their school might be okay and with them coming to their sports in the afternoon. And we're happy when you leave to go do stuff that's helpful for your recovery and good for your mental health, which certainly can be the case in some instances. In many other instances, we are going to have to take a break from some extracurriculars for some period of time while we're doing treatment. And what I encourage every parent and every patient to think about is just kind of what's the short-term benefit and what's the short-term cost, and then what's the long-term benefit and what's the long-term cost, right? If you're coming into treatment, it means something significant's going on. You're having impairment, you're having problems in your life. Things aren't going the way you want them to go. Could you scrape by, maybe rough things out, continue to have things go with that level of, modern impairment, but get by and still do that activity and not have to take a break for a month or two? Maybe you could, right? So the pros on that in the short term, you get to do it. The costs in the short term, you're still dealing with what's going on. If you zoom out from that and take a look 6 months from now, 12 months from now, 2 years from now, 5 months from now, 5 years from now, 10 years from now, do you really remember, your sophomore year, first semester's, tennis performance, right? Or do you remember how you felt as a person, your experience with life, how your overall well-being was during that time, if you're thinking about it right now? I know for me, it's certainly the latter, right? And if you're thinking about, is this problem gonna just go away and get better on its own? The answer to that, very likely, by the time you're looking at a higher level of care, is no. And not only is it not gonna go away on its own, it's likely to get worse on its own. The thing we know about adolescent mental health, it's also a little bit different than adult mental health, is that when we have untreated problems, be it ADHD, anxiety, beginning of addiction, substance use disorders, eating disorders, depressive disorders, there's so much data for so many different disease processes that if you don't intervene, if you don't get the help that you need, that things get worse in the future, and that's when things really go downhill. And so taking this break for the short period of time, it feels terrible in the moment. I get it. You're walking away from things that you're used to, that are routine, that were kind of keeping you going in the past. But when you take a look at how things go down the road, our patients are so happy to have been in treatment, are so glad to be, taking those real steps towards recovery. And, their grades later are thankful for it. Even their even their athletic performance is usually thankful for it, down the road when they're more engaged, healthier version of themselves and better able to give it 100%.